Hi and welcome to Synapse. This is Sonika. I'm back. It's been a pretty long time. I haven't posted since the last 12 months. I'll eventually let you know what happened and why I wasn't able to maintain the video schedules. Mm, anyway, let's get started. So, today we're going to talk about the higher topics in general surgery. First is talking about the weightage. It carries around 24 to 26 questions. It could be sometimes more than that, around 28, and sometimes it could be around 21 questions. So it's just a range. So this could be the approximate number of questions. About the subject, so general surgery is very logical and easy to follow provided your anatomy knowledge is really, really strong. And one recommendation, or what I would suggest, is when you read surgery, when you try to read a particular topic and try to remember it, it's better you do in terms of a case study. So try to remember a case discussion from your, practical classes, your clinical postings, or any topic that has been discussed in your uh, presentations basically. So if you remember it in terms of a patient encounter, let's say, you will remember the clinical features better, okay, and also the appropriately plan out the investigations and the management aspect of it. So it's very logical provided you have sound anatomical knowledge. So I highly recommend you finish reading anatomy and then move on to surgery. So resources, first with the coaching notes. Coaching notes, as I said, I had taken up the satellite classes during my third year. I had Bhatia notes from there, and then the class notes that you make in your final year, and then the additional points from guidebooks that I added to my personal notes. So I would like to highlight a book here. It's by Dr. Pritesh Singh. It's called Surgery Essence. It's a pretty decent book. I love the book for the fact that all the high yield topics regarding a particular topic is given in like the point wise manner, and it becomes very easy to read it. And then there are a number of image based questions, like the procedures maybe, or the suturing techniques, the surgical instruments. So a number of image based questions that have been given at the beginning of the book. So I think it is pretty useful, so you could all probably get a copy of that book. Now, moving on to the higher topics as such. First is the breast, the indispensable topic from surgery. So, here you need to know about the benign and the malignant conditions. So, in benign, we have ANDI, that is aberration of normal development and involution. So, then about fibroadenoma. These are the clinically most commonly encountered conditions. So that's why they tend to ask more questions or test you more from on these topics. So that's about fibroadenoma, then about breast abscess, then these are the benign conditions, and gynecomastia. Coming to the malignant diseases, there you need to know anything and everything regarding CA breast. So right from the risk factors, and then the genetic background, basically about your BRCA1, BRCA2, and the other genes that are involved, and the classification of CA breast itself, like the CA in situ and the breast carcinoma, the invasive breast carcinoma. Then, what are the investigations? Here it is the most popular method, that is a triple assessment. So that's where you have the clinical examination, then your radiological investigations, and then your tissue study, basically your FNEC. So how do you carry out these investigations? And then a word about BIRAT scoring, very important. And the TNM staging of breast carcinoma should be on your the tip of your tongue. You must be able to answer it even in your dreams. So TNM staging, extremely important. And now, based on this staging, you will have to know the management aspect of it. So when exactly do you need chemotherapy for a patient? Basically, like when you start the new adjuvant, and who are the set of patients who require surgery, and the group of patients who will require radiotherapy or hormonal therapy. So there are clear cut guidelines for this. and then it needs a little bit of understanding and effort. So as you figure out, and when you read this and you figure this out, it's better you put a flow chart for yourself so that you don't get confused for the when you do the second reading. Okay, so you just have to revise the flow charts. So as in when you understand, it may be for a surgical procedure or could be the management. It's better you make notes in the form of flow charts. That will make things a lot more easier. Next, coming to the surgery aspect, because this is general surgery, they'll ask a lot of things about the surgical management of CA breast. You need to know about mastectomy, the different types of mastectomies there are, and most important, at the post-op complications. What are the post-operative complications that occur? How do you like anticipate? How do you deal with it, and how to prevent these complications? And nowadays, more and more questions have been asked regarding the prognostic factors in CA breast, and which eventually will decide the outcome in a particular patient. Next, moving on to thyroid. Here you need to start from the development, okay? And I'm not mentioning it at every slide that anatomy is a must. So you finish your anatomy, then you open your surgery books, okay? So, and also have it side by side when you do surgery, read the relevant surgical anatomy and then start your surgery. Okay, so about the thyroid, development of thyroid is extremely important. The branchial arches. So, what are the arch derivatives? The arch arteries and the nerves, extremely important. And here you need to know about the thyroglossal cyst regarding the development aspect of that. And then coming to the thyroid nodules. So, thyroid nodules, it could be a single nodule or it could be multinodular condition. Then you need to know about the nature of the nodulism. Is it hot or cold, and how do you exactly manage? What are the investigations you order for such patients, and how do you exactly manage it? So thyroid nodules, again, important topic. And there's a lot of what do you call overlap between medicine and surgery here because of the hyper and hypothyroid conditions, that is Graves and Hashimoto's disease. So you will be reading it pretty much in medicine as well as in surgery. So it will be a good revision here. So do it properly at one place, and then the next time you read it, it will be a lot more easier and it will be just revision for you. And then here I highly recommend reading physiology of the thyroid gland, how exactly are the hormones produced and released. Okay, because there's a lot of connection between the physiology and the mechanism of action of certain drugs that we use in hyper as well as hypothyroidism. So highly recommend you attach your physiology notes from thyroid in your surgery or your medicine chapters. Next, about the CA thyroid. What are the different types of CA thyroid we see? Follicular, papillary, and medullary carcinoma, right? So, what are their important clinical features? Mode of spread, okay? How do we manage these, okay? And when it comes to medullary carcinoma, pay more attention towards the syndrome, its syndromic association, that is basically your MEN syndrome, okay? So, that's pretty important there. And finally, the surgical aspect are the steps of thyroidectomy. So, how do you perform thyroidectomy? Again, anatomy is the most important key here. So, as with any surgery, you should know the steps of the surgery, following that, the complications, post operative complications, and how do you manage them. Next important topic is general surgery that people tend to kind of ignore. Okay, but a lot of questions come from general surgery and forms the essence of your general patient care, right? So this is extremely important. You do a surgery, after that, how do you assess, how do you evaluate the patient, okay, how the patient is doing? So general surgery, it is very extremely important in your practice in the post-operative management of the patient. So you need to know about the fluids, okay, the electrolytes, and about the nutrition. Okay, extremely important. It's 6 o'clock. And then coming to shock. Shock is extremely important topic. It will be covered in medicine, pediatrics, surgery, and whatnot, everywhere. So shock is extremely important. So I suggest you make really good notes. You read from all the three, so all the three textbooks probably. Make a very good note. So fit everything possible in like one sheet, and then keep it with you. Every time you have to revise shock, just take out that one piece of paper and you read it. So it will become very easy for you to, integrate and then put everything in one perspective, in one place. Okay, so shock is one such topic. And burns is also important. There's not much to it. There are some things that you have to remember. And so you should know in and out about burns. Okay, next, about wound healing and repair. Again, this is there's an overlap between your pathology and general surgery over here, so we can just give it one good read, that's enough. Then coming on to the system proper, we're going into GI here. So first is about liver. You need to know about the anatomy of the liver, extremely important. The anatomical classification, the choanal segments of the liver, that is basically a functional aspect of it. And that forms the basis for your surgery. So the surgeries you perform on liver. So choanal system is important to understand. Then the benign conditions like, your liver abscess, it could be pyogenic, amoebic, and hydatid. How do you compare and contrast these three types of abscess, and how do you manage them? Then coming on to the hepatocellular carcinoma, and finally the liver transplantation. So there has been a lot about liver transplantation nowadays. So I highly recommend you read up the recent probably articles based on liver transplantation, the newer techniques that are involved in anastomosis and the post-operative complications, basically with the graft rejections and other complications associated with liver transplantation. And it's better if you integrate the concept of liver function tests here, because most often we order LFTs for people with liver disorder. So in order to interpret those levels and to come up with your differential or arrive at a diagnosis, it's important you know how to interpret the LFT. So from biochemistry and a little bit from physiology, it's better you jot down important points regarding the interpretation of the liver function tests. Next, coming on to the gallbladder. Gallbladder here, the most important thing to know is about the gallstones, how exactly they are formed, what are the different types of gallstones, and the symptomatology, how do they present to you, and once they come, what are the investigations you order for them, and if untreated. Okay, so you see, the patients can be asymptomatic, or they could be symptomatic, or they can come with complications as well, right? So like they could be gallstone ileus, or there could be perforation and leading to the pneumobilia and things like that. So basically, gallstone, there are a variety, there's an array of presentation for GB stones. So you need to know the whole spectrum of gallbladder stones. And then ultimately about a word about gallbladder carcinoma. Okay, then coming to the biliary system. Here you need to know about the normal variations of the bile duct. Okay, very important, and the injuries and strictures. Okay, injuries and strictures. Then lastly, about a word regarding cholangiocarcinoma. Coming to pancreas, pancreas here you need to know about the condition called pancreatitis. It could be acute or chronic. So acute pancreatitis has again a number of ways of presentation and complications. There are n number of complications associated with pancreatitis, and I need to know all of them and what are the pathogenesis exactly, and the management aspect of acute pancreatitis. Then about pseudocyst, how exactly the pseudocyst of pancreas is formed, and then a word about chronic pancreatitis. Compare it and contrast it with acute pancreatitis, and recent advances is regarding pancreatic transplantation, or you could add even a word regarding the islet cell transplantation. Next, moving on to esophagus. Esophagus, first you're going to study about the motility disorders. So that is achalasia cardia. Then Barrett's esophagus, which you'll learn in greater detail in pathology. But now we're going to look at the CA esophagus aspect of it, and how exactly do you diagnose it, and what are the surgeries that are available for CA esophagus. Okay, next a word about the diaphragmatic injuries and hernia. Then coming on to stomach, most important topic is gastric ulcer. So it could be benign ulcer or it could be a malignant ulcer. So hence, studying the features of gastric ulcers is extremely important. Then about H. pylori infection, how to detect the infection and how to treat it. Then regarding CS stomach, so what is important here is the classification. So there are different classifications that are introduced for CS stomach and a number of named procedures as well. So depending upon the location of the growth, you might have to carry out different procedure with different level of lymph node clearance. So here the classification plays a very important role. Then and I'll tell you, CA esophagus and CA stomach, the incidence is a lot commoner than you actually think. So until I got into my post graduation course, I hadn't seen many of CA esophagus cases, and now here, any case of dysphagia, they say in North Karnataka or parts of Maharashtra, over I mean basically dysphagia lasting for more than 2 months, you must have consider CA esophagus as your first differential. So that's how common it is. It's a lot commoner than what we think or assume. So hence this is important. These two topics are pretty important. Then in stomach, there's this pediatric concept that is pretty important. That's hypertrophic pyloric stenosis, and here you should know exactly what is the pathology that's happening and the electrolyte imbalance that it causes. So there might be a number of logical questions that can be asked based on this topic. Next is about intestinal obstruction. This is a star topic because this is what do you call not common in your casualty. That's what you see. Patient coming with pain abdomen, vomiting, and constipation or obstipation. So these people, and with abdominal distension. So these people are very likely to have intestinal obstruction, and this happens to be in surgical emergency. So detecting, diagnosing, and taking up the patient for emergency surgery is extremely important in this topic. So it is more of a practical applicable topic than textbook reading and just like mugging up the features or the surgeries for it. So here you need to know that there could be small bowel obstruction or large bowel obstruction. Small bowel obstruction is mainly because of additions. Okay, that could be from previous surgeries or some kind of um, intestinal TB infections like that, or could be a lymph node, which is like enlarged so big that it is compressing onto the lumen. So there could be a number of causes for small bowel obstruction, but the most common is adhesions. And coming to large bowel obstruction, the most common cause are the large intestinal growths. So there are a lot of things to compare and contrast. So you need to know about small bowel as well as the large bowel obstruction. As I said, the symptoms, how do they present, and what are the surgeries you do, and most importantly, the post-operative management of these patients. Then a word about mesenteric ischemia. That's also pretty important. Then these are all the miscellaneous topics that I've put together in the end. Then about the Meckel's diverticulum. Then GI tuberculosis. So when you're studying GI tuberculosis, concentrate more on the radiological features because that's what is commonly tested. But the treatment aspect of it, as you've studied in your medicine, would be and in the PSM would be a category 2, that is basically for your non-pulmonary TB. So that will remain the same. So here concentrate more about the radiological features. Then about the carcinoids, as carcinoids can occur anywhere, and it is pretty important that you know the spectrum of presentation of carcinoids and the treatment for it. Then about SMA syndrome, yeah, this is pretty rare condition, but so far I think I've seen 2 cases of SMA syndrome. So one was during my internship and one was during my PG. So it's not as rare as it sounds. And once you've seen a case of SMA syndrome, you will not forget it. So that's how it is. So just a word about SMA syndrome. Then about short bowel syndrome or intestinal failure. This is not a pretty what do you call common topic, or not pretty oftenly or spoken about. But this is like the topic of recent advance, or I can say gaining more importance as of now. Because see, if someone comes with an intestinal obstruction and you've done a resection and anastomosis of a long segment of the intestine, and now they have short bowel syndrome, and then eventually leading on to intestinal failure, and you cannot sustain them on total parenteral nutrition for a longer period of time due to so many number of complications that can result because of prolonged TPN. And ultimately you do what is called the short bowel syndrome, and this is not so popular in India yet, and that's why this could be the topic of interest for examiners. So we spend a little time on these topics. Then about the large intestine, Hirschsprung disease, uh, then about CA colon. Here you need to know about the FAP syndrome, then hereditary non-polyposis colorectal carcinoma. So basically the difference between condition where it's associated with polyps and there's a condition where there are no polyps. So both of them could result in CA colon. How do they present and what are the surgeries that you do for them? Then lastly about Crohn's and ulcerative colitis, again overlap between surgery and medicine here, but in surgery you need to concentrate on the surgical treatment options for these conditions. Next about appendix, not written anything much because you should know everything about appendix, right from the anatomy aspect of it, the acute appendicitis, how does it present, what are the surgeries we do, okay, and the steps involved in the surgery, and basically yes, everything regarding appendix is very important. Next, coming on to CA rectum, um, then hemorrhoids. Basically these are all the bottom topics, that is you have CA rectum, hemorrhoids, fistula in the pilonidal sinus, and here importantly about the good child's rule, pay more attention towards this. What are the inclusion and exclusion criteria for the application of good child's rule? And then coming on to hernia, again everything you need to know. You must be already masters in this topic because it's what you read more often, present more often in your clinical postings. So the different types of hernias, the anatomy of the inguinal canal, and nowadays they are asking more questions on the laparoscopic hernial repair because that is the most recent treatment option that we are providing for patients with hernia. So read about the laparoscopic hernial repair surgeries. Then coming to spleen you need to know just regarding the trauma, how do you grade the splenic injury, and then the splenectomy procedure. Next, talking about urology. Here you need to know about renal calculi. It's a very common renal calculi, and the ureteric calculi are very common in their presentation. So just know the different types of calculi and how are they precipitated, what are the causes or the predisposing factors for development of renal calculi, what are the investigations you order, and the management, which depends upon the size of the calculi and special interest or focus on the extracorporeal shock wave lithotripsy, ESWL. Next, about the genitourinary tuberculosis, pretty important in a country like India. You need to know TB manifestations in each and every organ if possible. Next is renal cell carcinoma. You should know everything about RCC. Then the renal trauma, again grading of the renal trauma and what are the procedure you perform for this. Then ureteric obstruction and injury. Just give it one read and that will be sufficient. Don't spend too much time on it. Then about bladder, urinary bladder. First is about the ectopic bladder, ectopia vesicae, and then what is the what do you call embryological defect that occurs which results in ectopic bladder. So that's what is important. Then about the stones, bladder stones, which could be primary or secondary, what exactly is the difference. And then regarding the CA bladder, how do they present, presentation of patients with CA bladder, and what are the treatment options we provide for them. Then about prostate, benign prostatic hyperplasia, pretty common clinical condition and causing retention of urine actually, and about the CA prostate. Next, urethra. you should know about the hypospadias, epispadias, phimosis, paraphimosis, and urethral injury. So this is very important because as of what we are seeing during my casualty posting, we've seen n number of cases with urethral injuries. Probably it's because um, many people who are not experienced are trying catheterization at the peripheries. They might not even be doctors. They're just like these healthcare workers, these sisters, or people who are not trained enough doing the catheterization and doing it all wrong, causing urethral injury, bleeding, and so much of stress and pain for the patient actually. So even for the interns, I suggest you look up the procedure of Foley's catheterization and follow the steps carefully. It could be right from injecting the right amount of local anesthetic into the urethra first. Okay, not just using a pea-sized amount of lignocaine jelly on the tip of your catheter. So just follow the rules or the steps involved in catheterization properly to avoid like a huge complication for the patients. Okay, so that's very 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 important, practically very important topic. So there might be questions on this topic. Coming on to the next topic, it's testis. What about undescended testis, torsion testis? How do you clinically identify it, and what are the surgical options that you can give? And then the testicular tumors. So here again, there's an overlap between your pathology and general surgery. Next is CA penis. I've tried to read up what do you call the presentation of this disease and the lymphatic spread. That's what is more common here, and the concept of sentinel node biopsy, or the sentinel node concept, lymph node concept, has come into play. It was first basically identified with the carcinoma penis. So read up about this topic. Then coming on to the arterial diseases. First is the peripheral vascular disease, pretty common clinical condition that you see, and vascular aneurysms. Okay, then lumbar sympathectomy. Though this topic, lumbar sympathectomy, it was a pretty commonly performed procedure in the past. Surgeons used to perform this left, right, okay, for basically relieving the pain associated with the peripheral vascular disease. But now it has become highly unpopular. We don't follow this anymore. It's probably because of the scar that it gave, the location of the scar. People thought it was, doctors told the kidneys or something. Because of those legal issues and stuff happening, this procedure is now being abandoned, and it might be asked in your exams. So mm, just go through the procedure and give it a good read. Then the venous disorders, that is DVT, deep vein thrombosis. You should know the predisposing factors and the complications that can occur if the thrombus dislodge and becomes an embolus and moves throughout the circulation. What are the complications that it can cause? How to identify these complications and how to manage the deep vein thrombosis. Then varicose veins, pretty important. What are different clinical tests for varicose veins, and the different treatment options we have apart from surgery. Okay, that is pretty important. And last is about the chest injuries. Okay, there's this whole concept of trauma. I think trauma is pretty important. You can spend some time reading the basically the resuscitation methods about triage and trauma management. So again, here chest injury is pretty important because uh, any compromise in the breathing mechanisms will lead to immediate death. So if there are other injuries you could address. If there's a broken femur, you could address. But what is the most important thing is to address rib fracture, as they can result in pneumothorax or hemothorax, or basically it will lead into immediate respiratory failure. So then about thoracotomies, okay, for elective surgeries as well, and the newer concept of VAT, video assisted thoracoscopic surgeries. Next, about the plastic surgery. Here you need to know about the different types of skin grafts, and a word about skin cancers, that is squamous cell carcinoma, basal cell carcinoma and malignant melanoma that you've been reading since your second year pathology, then again reading it in your dermatology, and then medicine, now in surgery. So you would have read this n number of times. Just give it one good revision here. Then about neurosurgery, here you need to know about the head injury, the different patterns of head injury and what they can result. Basically, extradural hemorrhage, subdural hemorrhage, subarachnoid hemorrhage, and what do you do for these conditions, and how exactly do you identify this on CT. So you must be able to read the CT brain of patients. So it's simply just pick up CT from your wards probably, and then just try to read it. Okay, you could ask one of your senior. It's very important to highlight and recognize the anatomical structures in the CT. Okay, and then you will be able to appreciate the abnormality. Okay, try to read a normal CT first, identify the normal anatomical structures, and then go on to identifying the pathology. Next will be the vascular aneurysms, that as vascular conditions in the CNS, that is the aneurysm, barioaneurysm, aneurysmal clipping, and so on, other procedures that are involved. Next, about intraparenchymal bleeds, how do they present, and how do you manage? And then the intracranial pressure. Okay, intracranial pressure is very important. How do you monitor this, and what are the ways you can decrease the intracranial pressure? This is extremely important. Next, about the CNS tumors, they can overlap between surgery and pathology. So pathology, you learn the different types, what are the microscopic features and the pathological aspects of it, and then surgery, in neurosurgery, just identify the prognosis. You need to know the prognosis associated with each of the conditions or the tumors, and the treatment options that is available. Next, about head and neck. So CA lip, CA tongue, salivary gland tumors, uh, they all are pretty important, not extremely important. So it's pretty important. So you could give it like 2 or 3 readings, make good notes, uh, extending up to 2 to 3 pages. I think that's enough. Don't spend more time on this. And then about the triangles of neck and neck dissections are pretty important. So you make good anatomy notes for this, revise your anatomy, and you need to know about the different types of neck dissections in detail. So that's the compilation of all the high yield topics in general surgery. And yeah, it always seems impossible until it's done. So keep working hard, always have a plan, okay, and all the very best. And I'll try to, keep myself up with the schedule of posting regular videos. I'll let you know about my postgraduate life journey, and my experiences here. Okay, thank you so much. Like, share, and subscribe, and keep loving Synapse. Thank you so much.